Chapter 7 Volatile, gaseous, intravenous, and dissociation anesthetics. Sorry. Volatile, gaseous, intravenous, and dissociative anesthetics. Volatile anesthetics. Volatile anesthetics: ether, chloroform, methoxyfurane, halothane, trichloroethylene, and fluorine and isoflurane are among the volatile anesthetics that produce general anesthesia after inhalation. Distribution of volatile anesthetics. Distribution of volatile anesthetics. Volatile anesthetics are stable within the body and are eliminated in the same form in which they are inhaled. Their movement within the body conforms to the fundamental gas law. A volatile anesthetic affects the nervous tissue by reversible physical union with the vital cellular substance. It is in the state of gaseous equilibrium. Volatile anesthetic is effective by rate of administration given generally by inhalation. In the alveoli of lungs, the anesthetic gas diffuses through the separating membrane into the circulating blood of lung capillaries. According to gas law of Dalton and Henry, greater the concentration of anesthetic gas in the alveolus, the greater is the partial pressure, Dalton's law, and that greater will be solubility in blood, Henry law. The gaseous anesthetic being dissolved in the blood is transported to lipoidal tissue into which it differs as a result of greater solubility in fat that in a gaseous medium. CNS contain more lipid than any other part of body and therefore attract more anesthetic than any other system. In addition, CNS is highly vascular so that proportionately more anesthetic is carried to that part of the body. This makes the CNS more susceptible than any other system to the effect of anesthetic because of high vascularity and lipoidal content. On the other hand, the anesthetic will diffuse out of the brain more quickly than other tissue with smaller blood supply. During the administration, concentration gradient is higher in arterial blood than in tissue of the body, and therefore much of the anesthetic in blood diffusion out into the tissue. The excretion of inhalant anesthetic is mainly through the process of diffusion but in reverse direction, and the rate dependent upon the ventilation rate of lung. Anesthetic accident, circulatory accident, anesthetic hypertension due to epinephrine release, anesthetic hypertension due to hemorrhagic or shock, surgical anesthetic. Treatment. The above condition may be treated with blood transfusion and oxygen administration. The body heat and moisture should be conserved. Ventricular fibrillation with chloroform and ethyl chloride during induction stage. Treatment. Make induction stage smooth and rapid. Cardiac massage, artificial respiration, cardiac arrest without fibrillation. Cardiac arrest without fibrillation can be treated with artificial respiration and cardiac massage. Respiratory accident. Central inhibition of respiratory may be combated by reducing the concentration of anesthetic. In case of brain surgery, intracranial pressure goes high or CSF pressure increase and thus respiratory failure occurs. Breathing holding in stage 1 and 2 stage. Pharyngeal and laryngeal spasm occur at the end of stage 1 and stage 2. Tongue swelling, Base of the tongue may fall back and goes back in the pharynx. Aspiration, aspiration. Debris and vomit may go back in the respiratory passage. Collapse of lungs. Some tissue, mucus, and clot may block the bronchiole and then corresponding alveoli may collapse. Miscellaneous accident. Miscellaneous accidents. Convulsion may occur but very rarely and mortality rate is close to 25%. Cerebral anoxia mostly occurs in anesthesia. Post-anesthetic fever within few hours temperature rise from 108 degree Fahrenheit to 110 degree Fahrenheit in human and patient die despite therapy. Anesthetic explosive. Anesthetic explosive. Most serious accident of occurs in operation room. Therefore, it is dangerous for surgeons, attendant, and the patient. Example: either ethylene, vinyl ether, ethyl chloride, cyclopropane, explosive chloroform. General line of treatment in case of collapse. General line of treatment in case of collapse. Remove anesthetic and give fresh air. Pull forward the tongue, lower the jaw, and extend the head. In small animal, invert the animal. Artificial respiration, throat respiration pump, chest massage. Cardiac and respiratory stimulant drug should be administered. Oxygen inhalation is superior. Method of administration of inhalant anesthetic. Method of administration of inhalant anesthetic. Open method. Liquid volatile anesthetic is dropped upon the wareframe mask covered with several layers of gauze and muslin cloth. Mouth and nostril may be covered with Turkish towel or several layers of gauze and volatile anesthetic is dropped upon it. Liquid paraffin or Vaseline may be smeared over the nostril to avoid irritant effect of liquid anesthetics. And B. It is a dangerous method because precise concentration of inhalant volatile anesthetic inhalant cannot be predicted. Semi-closed method. Semi-closed method. Volatile anesthetic is drawn from the surface by atmospheric air and is carried to the lungs through arterial mass and or through tracheal tube. Small animal. The exhalate gases are lost to atmosphere. Closed method with total rebreathing. Closed method with total rebreathing. It is most common, economical but cumbersome method. Under this method, the animal inhaled mixture of gases from a container through airtight mask or endotracheal tube in a small animal. The closed system gas machine delivers volatile anesthetic diluted in atmospheric air charged with oxygen into lungs. Exhaled gases are passed through the soda lime to absorb excess of CO2 and again it is charged with O2 for re-inhalation. The chemical reaction undergoing in this process is shown below. Potency of general anesthetics. Potency of general anesthetics. The margin of safety in the use of general anesthetics is small. Therapeutic index range from 2 to 4. Therefore, the amount that produce circulatory failure may be only 2 to 4 times, which produce adequate anesthesia. Choosing the dose of an anesthetic and for evaluating the depth of anesthesia is very essential. When a volatile anesthetic is inhaled as a gas or vapor, only a relatively small amount is actually absorbed. Anesthesiologists have therefore accepted a measure for potency of inhalation anesthetic known as MAC, minimum alveolar concentration. It is the minimum alveolar concentration which produces immobility, prevent gross movement to a painful stimulus in 50% animal patient in a state of equilibrated anesthesia. MSC is expressed in percentage. Chloroform CHCl3 trichloromethane. The use of chloroform in modern anesthetic practice is obsolete. It was used in horse and has been replaced by halogen, which is more safer anesthetic. It is used to produce euthanasia, painless death, for killing stressed dog. The BP of chloroform is very high, 61 degrees Celsius. It produces phosgene, which is very irritant. Ethyl alcohol is also used as a solvent or cleansing agent and as an ingredient in pharmaceutical formulation. Pharmacological action: moderate potency, MSC value 0.77% as compared to 0.87% of halogen. More potent than halogen, more soluble than halogen. Induction and recovery take longer time. More toxic than ether on heart and kidney. Pronounced cardiopulmonary inhibition. Nephrotoxic and hepatotoxic, produce central tubular necrosis of liver, fatty degeneration of heart, liver and kidney. Produce all the four stages of anesthesia, is not inflammable and explosive. Death in chloroform anesthesia. During induction stage, because of reaching higher concentration in brain due to a result of initial breathage holding followed by deep inhalation. This causes ventricular fibrillation due to excitement, and strangling epinephrine is released from adrenal medulla, precipitating cardiac fibrillation. Post-die, after few inspiratory gasps, adrenaline sensitize heart to the action of chloroform. In deep stage of anesthesia, it causes increased respiratory depression. Stage 4 may come as a death. After 24 hours of post-anesthesia, there is delayed chloroform poisoning. This occurs due to fatty degeneration of heart, liver and kidney, and central lobular necrosis of liver. Advantage: it is not flammable or explosive. Inexpensive. Induction and recovery is rapid. Easy administration, open method. Disadvantage: potential toxicity prevent its use. It has also been proposed to be carcinogenic. Use: brief anesthesia, small period anesthesia for bore and stallion castration. Ether. It is highly flammable and explosive. Ether is oxidized to peroxide when exposed to air and moisture. It is irritant and onset of anesthesia is delayed. Ether vapor is ignited and may cause explosion and hence not kept in refrigerator. Interference with electric relay mechanism of refrigeration. Never keep in refrigerator. Ether is metabolized to CO2, which is non-toxic. External usage: rubefacient when applied to skin and rubbed with friction, solvent of fat and inorganic matter, and used as cleansing agent. After oral administration, it is antispasmodic, carminative, and diffusible stimulant to heart. Inhalation: ether is safest of all general anesthetic when used with pre-medicant. Produce all stage of anesthesia. Satisfactory muscle relaxation due to motor and plate action. Neuromuscular blockade, central effect, and adequate analgesia. Does not produce cardiopulmonary inhibition, rather stimulates in the induction stage. Cost is low or inexpensive. Does not require complicated method of application. Disadvantage: potency low, MAC value high 3%. Induction and recovery slow because it is highly soluble in blood. BP 35 degrees Celsius, so difficult to use in hot climate. Flammable and explosive. irritate mucous membrane or of respiratory tract and increase the respiratory secretion. Clinical usage: permit satisfactory anesthesia in young pig, dog, calf and cat. Good laboratory anesthetic rat and mice. Ether and balance anesthesia. Pentobarb, pentothal for induction, ether for maintenance. Morphine, pethidine, atropine, necrosis plus ether. Methoxyfuran, methoxyfuran. It is not flammable and explosive. Can be used both in large and small animal anesthesia for both induction and maintenance anesthesia. It is most potent because MAC value is least 0.23%. Potency is irreversibly proportional to MAC value. It is cardiopulmonary inhibitor and causes circulatory and respiratory inhibition. It does not produce significant change in heart rate and blood pressure. It can produce cardiac arrhythmia, which is abolished by atropine. However, it produces hypotension. The induction and recovery is slow. Disadvantage: relaxation of skeletal muscle, loss of tone, and analgesia are excellent. It is not a hepatotoxic. Renal toxicity is a renal problem. It is metabolized in liver by the process of difluorination and dechlorination, and there is formation of dichloroacetic acid. The extent of metabolism is very high, 20%. Advantage: most potent, least MAC value, non-flammable, non-explosive, excellent muscle relaxant and analgesic activity. Involuntary excitement is less, stage second does not occur, not toxic to liver. Disadvantage: slow induction and recovery, pronounced cardiopulmonary inhibition, potential renal toxicity. Contraindication: may not be used in renal dysfunction. Clinical use: cattle. Slow induction and recovery of anesthesia, so it is mainly used as maintenance anesthetic. Pentobarbital sodium should be given for induction, followed by 1 to 30 methoxyfuran to maintain the anesthesia. Horse: it is not used as general anesthetic in horse. Halothane is preferred over methoxyfuran in equine. Pig: methoxyfuran 3% and N2O 70% should be given for induction for anesthesia. To maintain anesthesia, N2O 70% and O2 30% mixture is used. Sheep and goat: pentobarbital 20 mg per kg IV is given for induction stage 1st and 2nd. For maintenance stage 3rd and 4th, 2-3 methoxyfuran is given. Dog and cat: pre-anesthetic is followed by methoxyfuran. Xylazine is very good pre-medication in case of dog. Ketamine is preferred as pre-medication in cat. For induction and maintenance, methoxyfuran is used, but methoxyfuran is used for induction and maintenance anesthetic. Halothane. It is non-flammable and non-explosive anesthetic. Metabolism of halothane is through the process of defluorination and dehalogenation. Pharmacological action. Potency of halothane is next to methoxyfuran and chloroform. Methoxyfuran 0.23%, chloroform, halothane. The induction and recovery of anesthesia is rapid because of moderate degree of solubility. Excitement and struggling of stage 2nd are absent, which is an advantage. Cardiac arrhythmia may occur during induction. Bradycardia and hypotension may occur. 5. Respiratory depression is also marked. 6. Increased cardiopulmonary inhibition. Example in plants 3rd and 4. Muscle relaxation and analgesia adequate. Post-anesthetic nausea and vomition are less troublesome. Less side effect. Hepatotoxicity is not a problem in veterinary anesthesia. Advantage: moderate potency. Induction and recovery is relatively a rapid process. flammable and non-explosive, relatively non-irritant. It produces less respiratory tract secretion, low laryngeal spasm and salivation. It is used for both induction and maintenance anesthetic, but preferably it should be used as maintenance anesthetic. Disadvantage: cardiopulmonary inhibition is pronounced. It is expensive and thus should be used by semi-closed and closed system. Clinical use: cattle and horse, mainly used as maintenance anesthetic in equine. Because of high cost, not used for induction. The induction is done with prontobarbital sodium. Maintenance is done with N2O and halothane because N2O reduces the effect of halothane on inhibition of cardiopulmonary effect. Sheep and goat. As in cattle and horse, halothane plus N2O plus O2 is used as maintenance anesthetic. Similar procedure is adopted in dog and cat. It is not a totipotent anesthetic. State thickening is absent. Trichloroethylene. 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 It is a potent analgesic. It reacts with soda lime to form neurotoxin called dichloroacetylene, which is toxic to cranial nerve. It produces poor muscle relaxation. It possesses increased cardiopulmonary inhibition. The use of trichloroethylene as an anesthetic is obsolete. Enflurane. Enflurane. It is a new inhalant covalent anesthetic for use in human. It is chemically 2-chloro-112 trifluoroethyl difluoromethyl ether. It is a potent volatile anesthetic and structural analog of methoxyfurane. It is colorless, non-flammable liquid. It is non-metabolized and eliminated in expired air in the unaltered form. Pharmacology property: increase CNS irritability. It induces anesthesia and amnesia by functional disruption. Cortical hyperexcitability is produced in human at the concentration of 3.12%, and flurane produce grandimal seizure-like activity in horse. Twitching of facial muscle, neck, limb, and abdominal wall occur. Clinical uses: thiamycin or thiopentol may be given prior to enflurane. Muscle twitching does not occur. Diazepam anticonvulsant is given 0.35 mg per kg IM 45 minutes before enflurane. Minimize CNS excitation in dog. Pre-treatment of dogs with ethosuximide anticonvulsant is most effective drug in raising enflurane seizure threshold. Moderate level of surgical anesthesia is considered to be 1.5 mg. Depress cardiovascular function in the horse to a greater degree compared with halothane. Respiration depression is observed with a reduction in rate and depth after increased concentration. Advantage: non-irritant to respiratory tract. Renal impairment does not occur. Isoflurane. Isoflurane and enflurane are structural isomers. They contain the same number of atoms of fluorine, chlorine, carbon, hydrogen, and oxygen. It is non-flammable, halogenated, and most ideal with respect to biotransformation in human. It is metabolized to inorganic fluoride and trifluoroacetic acid. However, it is metabolized 1/10 that of enflurane and 100 that of halothane. It is not toxic to liver and kidney due to less metabolism. It is mildly pungent, similar to enflurane. The solubility of isoflurane in blood is lower than halothane, enflurane, or methoxyflurane. It has been approved by the FDA for anesthesia in horse. Pharmacological properties: it is non-convulsant anesthetic like enflurane. CNS irritability may be absent or reduced. The MAC in healthy unsedated horse is 1.31%. Anesthetic potency is greater than enflurane but less than halothane. In dog, MAC is 1.5% and 1.6% in cat. Depresses cardiovascular function equal to halothane but less than enflurane in horse. The margin of safety is greater for the cardiovascular system than that of other potent inhalant anesthetics. Provides skeletal muscle relaxation for surgical procedure. Recovery is shortest. Gaseous anesthetics. Gaseous anesthetics, nitrous oxide and cyclopropane are two important gaseous general anesthetics given by inhalation. Nitrous oxide N2O. Nitrous oxide N2O. Nitrous oxide N2O. It is grouped under major inhalant anesthetics used in veterinary medicine. Its importance has increased with the introduction of methoxyfurane and halothane in animal anesthesia because nitrous oxide decreases the cardiac pulmonary depressant effect of methoxyfurane and halothane. It is relatively insoluble in blood, thus induction is rapid. The potency of nitrous oxide is poorest with a MAC value of 105% man, 188% dog, and 205% cat. Nitrous oxide induced only stage 1 and 2. Therefore, it is least potent among all inhalant anesthetic. It produces excitation instead of depression of CNS. If administered at higher atmospheric pressure, nitrous oxide may produce cataleptoid-like symptoms and seizures, convulsions. It does not affect the cardiopulmonary function. Replaced of epinephrine and norepinephrine does not sensitize myocardium to the action of nitrous oxide. This agent must be used in combination with oxygen to avoid induction of hypoxia. If hypoxia occurs, it may injure the brain tissue reversible, which is a great danger. 20% nitrous oxide, while 80% oxygen produces only analgesia. The concentration most commonly used is 30% nitrous oxide and 70% oxygen that produce analgesia and loss of consciousness in some patients. However, 80% nitrous oxide and 20% oxygen produce analgesia and loss of consciousness in most patients, but at this concentration there is danger of hypoxia. Nitrous oxide does not affect liver and renal function. Muscle relaxation is poor and many produce muscle twitch and seizure in epileptic patients. Laryngeal spasm does not occur unless hypoxia is present. There is no side effect of post-operative nausea and vomition. Clinical usage: nitrous oxide and oxygen mixture cannot be used alone in maintenance of anesthesia. Therefore, nitrous oxide is commonly used with pre-anesthetic medication. It has been used as maintenance anesthetic in horses, pigs, ruminant, dog, and cat. Nitrous oxide, low potency. Nitrous oxide, oxygen, and halothane, high potency. A triple mixture is used. Nitrous oxide reduces the MAC value of halothane with a decrease in dose to 25% and provides good effect. Nitrous oxide, oxygen, and methoxyfurane is also used, but pre-medication of atropine and acipромazine is given before administration. Induction thiopental sodium IV is given followed by nitrous oxide and oxygen. Neuroleptic analgesic droperidol plus fentanyl is first given, then N2 plus O2. In ketamine dissociative anesthesia is followed by N2 plus O2. Cyclopropane trimethylene BP 32.9 degrees Celsius metabolized to CO2 to the extent of 0.5%. Rapid induction and recovery because it is almost insoluble. Potency is least, MAC value is higher. Example 70.5%, which is 6 to 8 times less potent than ether. MAC value 2.3% in dog. Less irritable to mucous membrane of respiratory tract, no renal and liver toxicity problem. Least toxicity problem. It has least effect on respiration, therefore preferred in thoracic surgery. Blood pressure is rarely affected. Disadvantage: flammable, very costly, muscle relaxation is poor. There is tendency of capillary oozing because of vasodilation. There is a tendency of capillary oozing because of vasodilation. Cumbersome method of administration, closed method with total rebreathing. Mainly used in human use, declined due to least potency. May be used in small animal. Intravenous anesthetics. Intravenous anesthetics. Intravenous anesthetics. The stage of anesthesia obtained after IV anesthetics are similar to that of inhalant. However, one can proceed rapidly through induction with IV anesthetic as compared to inhalant anesthetic. Stage 2 of anesthesia is bypassed by IV anesthetics. Therefore, struggling and excitement of induction is avoided. Advantage of IV anesthetics: it is easy to administer. It directly produces stage 3 of surgical anesthesia. It is safe for patient, veterinarian and handlers. It may be administered in the presence of dithermy or thermocountry. It provided smooth recovery, post-show excitement. Nausea and vomition are absent. In some cases, vomition may occur in recovery period. Post-anesthetic period is free from complications. It does not interfere with operative area. Disadvantage of IV anesthetic. Disadvantage of IV anesthetic: depth and level of anesthesia is not controlled. The overdose cannot be easily detoxified. It provides moderate muscle relaxation. It does not relax abdominal muscles. Classification of IV anesthetics. Classification of IV anesthetics: barbiturates. Example: pentobarbital sodium, nembutal, thiopental sodium, pentothal, thimethyl sodium, thiobarbital, methoxytal. Non-barbiturates: chloral hydrate plus magnesium sulfate, chloral hydrate plus magnesium sulfate plus pentobarbital sodium. Dissociation anesthetics: phencyclidine, ketamine, tiletramine. Steroid anesthetics: althecin. Neuroleptic anesthetic: droperidol, fentanyl. Droperidol plus fentanyl plus N2O 66%. Miscellaneous agent: alpha chlorolose, urethanase, etomitate. Barbiturates. Barbiturates are derivative of barbituric acid or malonylurea. Barbituric acid as such as represent effect on CNS. The basic compounds barbituric acid is the condensation product of urea and malonic acid and consists of a 6-membered ring structure. To make barbituric acid, Effective some substitutions are made by replacement of the hydrogen atom attached to the carbon atom 5 and 2. There are many barbituric acid derivative. Example: butabarbital, hexabarbital, methobarbital, talbutal. These derivatives of barbituric acid are seldom used in veterinary medicine. Most widely used barbituric acid derivatives are phenobarbital, sodium barbital, sodium amobarbital, sodium pentobarbital, sodium secobarbital sodium, thiopental sodium, thimethyl sodium, thibarbital sodium, and methoxytal sodium. The later mentioned barbiturates are widely used. Chemistry: barbiturates are colorless, odorless, crystalline, white powder having a bitter taste, except sulfur containing barbiturates, and are sprinkling soluble in water. They are hygroscopic and decompose after exposure to air, heat, and light. Therefore, they are kept in dark bottle, sealed ampoules, or colorless capsule. Solution of barbiturates decomposes rapidly. However, solution or certain thiobarbiturates entirely decomposes in 36 hours at room temperature, but will last longer if refrigerated when the hydrogenase on carbon 5 are substituted with an alkyl or aryl group. Depressant activity on the CNS is possessed by the compound. A few barbiturates contain sulfur atom attached to carbon 2 in place of oxygen. Barbiturate with carbon 5 substitute are springly soluble in water. Solution of barbiturates in water are weak acid and combine with sodium or other fixed alkalis to form water soluble salt. The Na plus atom join the oxygen atom of carbon. This salt form alkaline solution of a pH between 9 and 10. Structure activity relationship. Structure activity relationship. Both hydrogen atom on carbon 5 must be replaced by an alkyl or aryl group for CNS depressant activity. The substituting radical on carbon 5 should contain a minimum of 4 and maximum of 9 carbon for obtaining optimal therapeutic effect. Additional of more than 9 carbon at C5 lead to convulsant activity. Unsaturated carbon chain are readily oxidized and act as short acting. Short chain are more stable and therefore act as long acting. Long chain are easily oxidized and act as short acting. Branched chain provides shorter duration of action than straight chain. Only one aryl radical should be attached to C5. Substitution of the oxygen atom on C2 by a sulfur atom increases potency and instability but decreases duration of action of the compound. Attachment of an alkyl group to one of nitrogen atom at position 1 or 3 increases the anesthetic potency and stimulates the CNS. If substitution is made in both nitrogen atom, convulsant activity is obtained. Classification. Long acting barbiturate, duration of action 6 to 12 hours. Phenobarbital, intermediate or medium acting, duration of action 3-6 hours. Butobarbital, pentobarbital, short acting 1 to 3 hours. Secobarbital, hexobarbital, ultra short acting 20 to 30 minutes. Thiopentanol, thiobarbital, methoxytal. Pharmacological action. Barbiturates cause the reversible depression of the activity of all excitable tissue, primarily the CNS. The exact mechanism of action of barbiturates are not well known. However, it is believed that barbiturates facilitate inhibitory neurotransmission in the CNS by interacting with protein of the GABA and thus open chloride channel and hyperpolarized neuronal membrane. Central nervous system. Barbiturates depress the CNS from a mild sedation to general anesthesia. They depress the polysynaptic response and thus delay the synaptic recovery. Small doses may have GABA-like action. Sedation and hypnosis. Sedation and hypnosis. The long and intermediate acting barbiturates are used for sedation and hypnosis. Therefore, phenobarbital is given for sedation and pentobarbital is used for induction and maintenance of sleep. Anesthetic effect. Thiobarbiturates short acting after IV administration produce basal or general anesthesia. Anticonvulsant effect are barbiturates if given in anesthetic dose inherit convulsion due to epilepsy and tetanus. Phenobarbital and mepobarbital are used to prevent grand mal epileptic seizure. Analgesic effect. Barbiturates lessen the pain sensation, producing a loss of consciousness. Spinal cord. Barbiturates depress the polysynaptic and the monosynaptic reflexes of the spinal cord. Cardiovascular system. Cardiovascular system. Barbiturates may cause a slight decreases in blood pressure and heart rate. Toxic dose of barbiturates produce hypotension for a longer period due to direct depression of myocardium and the vasomotor center. Hypoxia, blockage of sympathetic ganglia. Respiratory center. Therapeutic dose of barbiturate depress respiratory slightly, not indicate the reticular formation, feed signal or impulses into the medullary control centers governing respiration. Thus, the cat react adversely to barbiturates. Therefore, anesthesia must be induced with particular caution until learn more about the sensitivity of the cat to barbiturates. Sub-anesthetics does of barbiturates increase respiration rate. However, large drugs are depressant to the respiratory center in the medulla. Dose of barbiturates that induce deep surgical anesthesia severely depress the respiration, producing dangerous hypoxia and respiratory acidosis. Barbiturates inhibit respiratory center at lower blood concentration than that arresting the heart. Therefore, in case of respiratory arrest during barbiturate anesthesia, respiratory should be re-established because the heart continue to function for a brief period. Gastrointestinal tract. Sedative dose of barbiturate do not affect the mortality or gastrointestinal tract. Kidney. Hypnotic dose of barbiturate do not affect the urine output. When barbiturates are given IV to produce anesthesia cause decrease in urinary output due to decrease in glomerular filtration rate. Acute barbiturate toxicosis is generally associated with oliguria due to severe hypotension. Liver. In therapeutic dose, barbiturates do not produce hepatic disorder by combining with cytochrome P450 competitively interfere with the biotransformation of a number of substrates of this enzyme. Barbiturates that do not undergo significant hepatic detoxification stimulate the microsomal enzyme systems responsible for drug inactivation. Barbiturates also stimulate the hepatic metabolism of certain other agents. Uterus and fetus. Sedative dose of barbiturate do not affect uterine activity. Anesthetic dose depress the uterine concentration during parturition. Pentobarbital and thiopental in concentration that do not produce maternal anesthesia inhibit fetal respiratory movement. Clinically, caesarean section performed slowly under barbiturate anesthesia depress the fetus and may cause 100% fetal mortality. Metabolic rate. Metabolic rate. Sedative dose of barbiturates do not affect the basal metabolic rate. However, dose of barbiturates that produce surgical anesthesia depress basal metabolism, thus less body heat is produced during anesthesia and there is excessive heat loss due to vasodilation. Therefore, patient going under surgical anesthesia must be kept warm, especially when overdose is given. Metabolic rate. Metabolic rate. Sedative doses of barbiturates do not affect the basal metabolic rate. However, doses of barbiturates that produce surgical anesthesia depress basal metabolic, thus less body heat is produced during anesthesia and there is excessive heat loss due to vasodilation. Therefore, patient going under surgical anesthesia must keep kept warm, especially when overdose is given. Skeletal muscle. Barbiturates do not relax the abdominal musculature, therefore, for getting more muscles relaxation, D-tubocuranine may be used. The photomotor reflex should be checked to determine whether the animal is regaining consciousness when skeletal muscle relaxant is used with a barbiturate anaesthetic. Barbiturate cause muscular ischemia during the recombinant phase of anesthesia, leading to post-anesthetic for lameness due to weight of large animal laying in recombinant position. Absorption. Barbiturates are readily absorbed orally or intramuscularly. They are weak acid and maximum absorption occurs from the stomach, especially in dog. Sodium salt are uniformly and rapidly absorbed after oral administration. The rate of absorption is faster for short-acting and slower for long-acting barbiturates. After an IV injection, pentobarbital in plasma reach distribution in the brain within 3 to 4 minutes. Distribution. After absorption, barbiturates are distributed throughout the body. A fraction of the barbiturates in blood is reversibly bound to plasma albumin. They cross the placental barrier and may be secreted in milk. Their lipid solubility, degree of protein binding, and percent of ionization affect their distribution. The apparent value of volume of distribution differs in different species. The VD value of pentobarbital is 0.72 liter per kg in goat after IV 30 mg per kg administration. The half-life of pentobarbital in goat is 0.9 hour, whereas in dog it is 8.2 hour. Thiopental is highly lipid soluble and passes the blood-brain barrier. Pentobarbital has low Partition coefficient, penetrates the blood-brain barrier more slowly. Therefore, phenobarbital take 50 minutes or even more than this to depress CNS after IV administration. Barbiturates remain in plasma both in ionized and non-ionized state. The ionized form does not cross the biological membrane and cannot be reabsorbed by the kidney tubules. The elevation of blood and urine pH increases the ionization of barbiturates and thus causes an efflux of barbiturates from the tissue into the plasma. Thus, the increase in pH of plasma and urine prevent their reabsorption by the kidney tubules and increase their excretion. Metabolism. They are metabolized by the microsomal enzyme in the liver. The inactive metabolite are conjugated with glucuronic acid are excreted through urine. Phenobarbital is excreted 25 to 30% unchanged of the dose administered. Therefore, in patients suffering from renal damage, it is safer to administer compounds like pentobarbital, which are completely metabolized by the liver. Activity of drug metabolizing enzyme in hepatic microsomes may be affected by several factors. Newborn and young animals possess less capacity to metabolize drug. Hepatic microsomes are also depressed to a greater extent to metabolize the drug. Phenobarbital and phenytoin accelerated the liver microsomal activity. Therefore, some drug and other may be metabolized at a greater rate. For example, phenobarbital stimulates the metabolism of other barbiturates. As a result, animals become tolerant to this drug because of a greater rate of metabolism. The rate of metabolism varies between various species. Barbiturates are metabolized at slower rate to that in human and take longer time in metabolized barbiturates. Pentobarbital is metabolized slowly by human 4% per hour as compared with in dogs 50% per hour and horses 50%. Ruminant metabolize pentobarbital at high rate. Clinical use of barbiturates. As an anesthetic. Pentobarbital is used as anesthetic in dog and cat. Dog. For IV anesthesia in dog, pentobarbital 24-33 mg per kg in 3 to 6% aqueous solution should be used. Average IV dose is 30 mg per kg. Cat. Pentobarbital at the dose of 25 mg per kg IV produces anesthesia. An additional dose of 10 mg per kg if initial dose do not produce desired anesthesia is given IV. 1/2 of the dose should be injected at a moderately fast rate so that the stage of excitement, stage 2 of anesthesia is bypassed. Few seconds to 1 minute is allowed the drug to exert its full effect. Thereafter, the pentobarbital is injected to effect. It is administered slowly in repeated small amount over a period of 2 to 4 minutes with continuous observation of reflexes and respiration until the desired depth of surgical anesthesia is obtained. As anticonvulsant, phenobarbital is used in epilepsy. Euthanasia. Pentobarbital is commonly used for euthanasia of small animals, dog 40 to 60 mg per kg. As sedative, pentobarbital is used for sedation in falls and small colds. It can also be used as sedative in large animal 1 to 4.4 mg per kg IV. Adverse reaction: intolerance, allergic reaction, megaloblastic anemia, tolerance, drug interaction, drug dependence. Non-barbiturates IV anesthetics. Non-barbiturates IV anesthetics. Chloral hydrate. It is among the first CNS depressant which was used in veterinary surgery. Even today, it is one of the best hypnotic available for large animal. Its use is very rare in small animal. The silent feature of chloral hydrate is given below. Effect on CNS. Chloral hydrate mainly depresses the cerebrum. It is not a good analgesic and muscle relaxant. It is better sedative hypnotic that anesthetic because margin of safety is very narrow. Do not depress sensory cortex up to the mark. It is used for light sedative action and colic in horses with antizymotic and carminative agent used in cattle to depress nervous excitement or even mania that make accompany acetomania used for hypnosis preceding local anesthetic or regional anesthetic in large animal used as maintenance anesthesia ether and halothane at the dose of 1 gram per 9 kg body weight as 10% solution IV. Chloral hydrate and magnesium sulfate. The combination of chloral hydrate and magnesium sulfate is known as Dank's formulation. Chloral hydrate 12% and magnesium sulfate 6% is given slowly IV 30 ml per minute in horses for anesthesia in large animal. With the appearance of stage of surgical anesthesia, administration is discontinued. Surgical anesthesia is indicated by absence of nystagmus and other reflexes. Initially, it was thought that magnesium sulfate enhanced the action of chloral hydrate, but it is not true. Magnesium sulfate has got neurotransmuscular blocking activity, thus produces skeletal muscle relaxation. Magnesium sulfate given alone produce only neuromuscular blockade and that due to asphyxia and thus is inhuman to use it as euthanasis agent. Chloral hydrate 12% and magnesium sulfate 12% of each 6 gram per 100 kg body weight is given IV for anesthesia in camel. Chloral hydrate, magnesium sulfate and pentobarbital sodium. Chloral hydrate, magnesium sulfate and pentobarbital sodium. It is a good anesthetic for horses and cattle. It is very cheap and consists of 30 gram chloral hydrate, 15 gram magnesium sulfate and 6.6 gram pentobarbital dissolved in 100 ml water. The above combination is also known as Millenberg and Velinega formulation. For general anesthesia in horse, 30 to 70 ml of the above solution per 45 kg body weight is given IV. The above solution must be used within 1 hour, otherwise precipitate occurs. Duration of anesthesia in horse is 30 minutes. The margin of safety is fair. Recovery is satisfactory. The recovery of muscle tone occurs along with the return of consciousness so that horses can stand on their legs immediately after recovery. Clinical usage for sedative in horses, for restraining and handling of cattle for diagnostic purposes, anesthesia in bird for these purposes, chloral hydrate, pentobarbital and magnesium sulfate are dissolved in 500 ml of distilled water. This aqueous solution is mixed with an aqueous solution of propylene glycol with 9.5% alcohol. The above preparation is injected into pectoral muscles of the bird in dose of 0.2 to 0.25 ml per 100 gram. Dissociative anesthetics. Dissociative anesthetics Pencyclidine hydrochloride and its congeners ketamine hydrochloride and tiletamine hydrochloride are currently used as dissociative anesthetic drug in veterinary medicine. The term dissociative anesthetic originated from the use of ketamine in human medicine. Dissociative anesthesia is defined as the feeling of to be dissociated from or unaware of the environment during induction. Ketamine hydrochloride. Ketamine hydrochloride. Ketamine is a general anesthetic which was first introduced in humans in 1965. In 1970, it was introduced for anesthesia in the cat. The important feature of ketamine is as below. It induces stage first and second, but not third and fourth. Ketamine does not act on ARS ascending reticular system like other anesthetics. It produces depression of thalamoneocortical system and stimulation of limbic system. Therefore, due to dual action, ketamine is called dissociative anesthetics. It induces catalepsy, amnesia, anesthesia by functional disruption, dissociation of CNS through marked CNS excitation. It produces dissociation or complete unawareness of environment due to amnesia, forgetfulness. Action on CVS. Ketamine increases cardiac output, blood pressure, central venous pressure, and heart rate. Cardiac stimulating properties provide it a good induction agent for poor risk and hypovolemic patient. It does not depress respiration. There is profound analgesia and amnesia. Muscle relaxation is poor. Induction rapid but recovery is prolonged. There is only little salivation, which is not a problem. Swallowing reflex is impaired. It possesses wide margin of safety, example 5 times than that of pentobarbital. Mechanism of action. Mechanism of action. Ketamine prevent reuptake of GABA by brain cells, thus act by GABA mimetic mechanism. It also blocks neuronal transmission mediated by 5-HT dopamine and norepinephrine across the synapses. Nerve ending. Dose cat 44 mg per kg IM. Maximum dose 50 mg per kg. Duration of action is shorter. Example 30 to 45 minutes. If dose is increased further, then duration of anesthesia is increased. In small animal, it is given at the dose of 5 to 10 mg per kg IV. Sip and go 2 mg per kg body weight IV. Thank you.